morning, ladies and gentlemen. I'll stand on the protocol and give you greetings from my minister, who is engaged in another equally important engagement. Uganda is honored to be part of the UN group of friends to eliminate hepatitis at a time when the United Nations General Assembly is hosting the 3 high-level health-related summits. The elimination of viral hepatitis is Uganda's priority when implementing the SDGs, particularly the SDG 3.33 regarding the combating the viral hepatitis. Viral hepatitis continues to be a public health threat, and with in Uganda, about 6%, which is about 2.5 million people having or living with chronic hepatitis B. In addition to hepatitis B, Uganda is grappling with other communicable diseases such as HIV, tuberculosis, and malaria. The good news is that Uganda has made significant strides towards the viral hepatitis elimination. For instance, in 2015, the country developed a national hepatitis strategy that mainly focuses on promoting the vaccination of infants with the pentavalent vaccine, alongside the mass testing and mass vaccination of adolescents and adults against hepatitis B, which is a very key priority to guide the implementation of the hepatitis B control. Currently, we are in the process of concluding another strategic plan with a focus on reducing the new viral hepatitis B and C infections, reducing the hepatitis-related deaths and morbidity, and strengthening the awareness and social mobilization for hepatitis testing and treatment. The country is taking a high level of engagement, being one of the core strategies. You've seen the statistics today that we have still low testing, and majority of our populations are still unaware whether they live with this condition. And so during the recent commemoration of the International Hepatitis Day, we're amazed that we had huge numbers turning up at the function to do testing and screening. And that is a condition that actually once we scale up engagement, we can see a big stride in reducing this kind of condition. Uganda has adopted the introduction of hepatitis B vaccination for the newborns into the national immunization program as a significant step towards the protecting newborns from the hepatitis B infection and the risk of complications later in life. We have continued the advocacy among the parents, the caregivers, the health workers, and the general public, which is one of the strategies we have employed to scale up the hepatitis B newborn vaccine. As part of the triple elimination strategy for HIV, syphilis, and hepatitis B, universal screening of pregnant women for hepatitis B is now part of our routine services offered at the antenatal care. This will help us to reduce the newborn infections among the children below 5 years to reach the global elimination targets of less than 0.1 prevalence for hepatitis B among the children in that age group. Therefore, these interventions are expected to fast-track the country towards the WHO goal of eliminating the viral hepatitis as a disease of public health concern by 2030. The government of Uganda still continues to show strong political commitment and increase access to prevention, testing, and treatment services by integrating the services into the existing platforms at all health service levels. This aims at early diagnosis and prompt linkage for care for those affected with ensuring quality of health care. So we continue to ensure high-level commitment at government level, putting the high-level decision makers in terms of policy direction so that everybody is not left behind for efforts towards eliminating the hepatitis B. I thank you all for listening.